All
We're
right.
gonna we're gonna get started. Hey, right before we get started, everyone, here's somebody else. If you would please introduce yourselves and just tell us uh where you are right now in your journey related to school, where you're from right now, currently as well. And that way it'll give us a little bit better idea as we introduce ourselves and talk about oral
Mm-hmm.
health and dentistry. So, first person I see on the screen here is Christopher. So you're up, man.
My name is Christopher. I live in Brooklyn and I go to the Stony Brook School in Long Island. It's a boarding school, but I'm a 5-day boarder there.
Welcome, welcome.
That's
Was
in
it
your
Adrian
high school, but it's
High School?
affiliated with Stony Brook University.
No, it's not.
Okay,
They're
but it's just
they're
out
across the
there.
street from each other. Yeah.
Okay, good. What grade are you in?
I'm a sophomore.
Okay.
Awesome. Was that Adriana or Adrienne? Adriana? Did I say it right?
It's Adriana. Yeah.
Adriana.
Um, I currently go to Manchester High School in Connecticut, and I'm a sophomore.
Welcome. Who's next
M-
up?
M- Madeline?
Hi, my name is Madeline. I currently live in New Jersey. Um, I'm, I go to Science Park High School and I'm a junior.
Okay.
Next up is Derek. Welcome, Derek.
My name is Derek, and I'm a sophomore in high school in Houston, Texas. I go to Jordan High School in like the Katy area.
Okay.
Katie,
Welcome.
welcome off I-10. I know where Katie
Yeah.
is. Yep, yep. And Rashida, welcome.
My name's Rashida. I currently live in Canada and I'm a junior in high school.
Canada, nice. You
Awesome,
got an
Canada.
international crowd. Okay.
Yeah, that's great. Alexis, welcome. Tell us a little bit about yourself, Alexis. You have to unmute your mic.
Let's come back to Alexa. Let's get moving. I'm going to set a timer for about 30 minutes. That's going to put us at 12:50, and that would give 10 minutes for question and answer. Does that sound about okay? 25, 30 minutes.
And everyone, as you are listening, if you do have questions, write them down.
Yes.
Write them down so you don't forget.
All
So,
right,
are
let's go.
you, Christopher, Madeline, Adriana, Derek, Rashida, and everyone else to introduce yourself, are you guys the next dentist or oral health physician? That's what we're going to talk about today, okay? And we're going to talk about dentistry. So, you heard a little bit about our introductions, but we'll go into that a little bit more. But more importantly is talking about dentistry. What is dentistry? It's the medical field that focuses on the health of the teeth, your gums, and also all the other structures that are in the mouth, but also in the head and neck area as well. Dentists are doctors. We definitely want you all to know that dentists are doctors. All right. Within the medical and dental profession who diagnose, prevent, and treat diseases of the oral cavity and those conditions. And we also, as dentists, play a major role in detecting cancers. There are cancers that can be found in and around the mouth, and also any other health issues that manifest in and around the mouth. Kind of think of us as the specialists in the medical field related to medicine that are focusing on the mouth and the teeth, right? So just brief a little bit about me. I am I am a non-traditional dentist, meaning my pathway to dentistry was not typical, especially since as an undergraduate student, I did not study anything related to health science or anything related to medicine. My background was in architecture, and that's a whole nother discussion. But I did go to dental school at University of Maryland. I did a residency, which is some advanced training, a 1 year residency training after dental school. I spent some time in the Air Force, military as a dentist, had a chance to travel around the world. I went to Korea. I was also stationed at the Pentagon in DC. Been in private practice in many different states, some of which states that you guys are from right now. I heard Houston, Texas, but practiced there, also in Nevada, California, and the LA area, uh, and also in New Jersey and Pennsylvania. And for some time, I spent running a residency program, training new dentists after they received their dental degrees and wanted to do some additional training in advanced dentistry. Currently, I've been holding a position for the state dental director of New Jersey. Actually, I just transitioned from that position to another one, but this was very important for our state, New Jersey, where I was responsible for policy, oral health, preventative care, for New Jersey's 9 million plus residents, and currently work on one of my passion projects as the new dentist coach, where we have a podcast and education channel to help individuals like yourself who are considering careers in medicine, more specifically dentistry, doing some coaching, speaking, consulting. And we also just launched an Oral Health Scholars Institute, and we'll have some more information about that for some of you that are considering dentistry, but also looking to get some help and some mentorship during this journey. So that's a little bit about me, and Dr. Small is going to talk a little bit
Yes,
about her
sir.
career journey.
All right. Head to the next slide. Yeah, no. Okay. So, yes, I'm from New York. I went to high school in Brooklyn. Christopher's from Brooklyn. I went to Brooklyn Tech. And after that, 2002, finished did my bachelor's of science in biology from Howard. Stayed at Howard from 2003 to 07, completed my doctorate of dental surgery. So I got my DDS from Howard. After that, I moved to Boston, went to Tufts University, did my certificate in endodontics. So for dentistry, similar to medicine, once you were in dental school, we learn how to do everything. We learn how to do dentures, pulling, filling, cleaning, everything. After that, you do your license exam and you are a general dentist. I chose to specialize for 2 extra years. So I went to school for 2 extra years, just concentrating and focusing on root canals. So my specialty is limited and my practice is limited to endodontics. That's my specialty. There are maybe 7 or 8 other specialties that are acknowledged by the American Dental Association. So if you're doing oral surgery, orthodontics, prosthodontics, periodontics, those are all additional residency trainings after dental school. And I'll highlight my residency was 2 years. Some are 3 years, oral surgery 4, 6 if you do a combined MD. But one thing that makes dentistry a little more appealing and different, they're two different specialties, but between dentistry and medicine, a little bit different. But our postdoc trainings are much shorter, so that we get more into private practice a little bit sooner. Okay, that's not a reason just to choose dentistry, but just when you're thinking about the timeline, ours is a little bit shorter. In 2012, I founded a practice in New York City, private specialty practice called Mentee Endodontics, which is where I have been working. That's been my home almost for the past 12 years. I was previously on faculty at Columbia University as an associate clinical instructor, also at Interfaith Medical Center in Brooklyn. Since 2017, sorry, I'll include all of my extras. So both Darwin and I, we do a lot of extras in addition to clinical practice. National speaker and lecturer. I've done several lectures and speaking engagements at different local, New York, other states, and national dental conferences, and also international. I work as an expert witness, which means that I work with attorneys to help establish the standard of care or breach of the standard of care in malpractice cases. So anytime someone wants to sue their dentist, they need to have an expert witness on their side to determine if there was a standard of care breach or not. So I work with attorneys for that. I am an entrepreneur. I am always looking for something to do, maybe in a good way, maybe in a bad way. I'm a real estate investor. I'm a mother. I am a wife and a marathon finisher. And I say these to say we do things outside of our career. We all have our careers and aspiration goals, but we do want to maintain our life work balance and harmony. So we all try to do that with our Darwin has, passion projects with the podcast and all these things that we're doing here. These help maintain our work-life wellness balance. All right, let me get one next slide, please, Darwin. Okay, so I want to do a clinical case. This is a patient that presents with pain on chewing. And initially, when we looked on the x-ray from his general dentist, nothing, they opted at that moment not to do anything because the pain was there. The patient complained of pain, but it wasn't really a big, big amount of pain. So fast forward 2 weeks, I'm going to show you what he looks like. Next slide, please, Darwin. This is not the patient, but he looked exactly like this when he came into my office. This is swelling of the submandibular space. All of that came from one tooth. Yes. Okay, fast forward to the next slide. With the submandibular space, and Darwin emphasized that as dentists, we are physicians of the head and neck. We focus on the head and neck. So with that patient, he came in with swelling of the submandibular space. So depending on where the roots of the teeth, the positioning and the alignment are in relation to the muscles, you will have swelling that can go from 0 to huge very, very, very quickly. Okay, so with the swelling of the submandibular space, that's only one space. There's several spaces in the head and neck facial spaces. This swelling, it needs to be managed quickly, it needs to be managed appropriately, and it needs to be managed aggressively. And the reason why is because it can go easily just from swelling to life-threatening very quickly. One thing I want to highlight is something called Ludwig's angina. With Ludwig's angina, you will end up in the hospital if you get that. The patient will say that they feel like they have trouble swallowing. That means that your airway is closing up. Because if you look at the picture on the screen, this is a very, very, very simplified version, and there are many, many more muscles involved. But when you get to swelling of the submandibular, the sublingual, and the other spaces, those three spaces, what happens is that you're closing off your trachea. That means you can't breathe. So this patient, if you end up with Ludwig's angina, you don't have time to go to CVS and get an antibiotic and take a pill. You need to be at the hospital because you need to get IV antibiotics because that needs to be managed aggressively and appropriately. Next slide, please, Dr. Hayes.
Dr. Small, real quick, can
Yes.
you explain a little bit what they're looking at in this picture, just so they have an idea?
Sure. And we have other pictures that are much better. So where your mouse is the tongue.
Right. And
And
then
that blue space is going to be the submandibular space. So when it's swollen, it's pushing up. So it's pushing
pushing
your
up the tongue.
tongue. Yes. So that tongue is going up and back because normally your tongue is big, but it's, in its normal position. When it's pushed up and back, it's going back over your trachea, which means you're going to have problems breathing.
And this is that space I'm looking at right here. This is
Yes,
the
yeah.
airway
The
where it allows
epiglottis,
you.
yes,
Right.
yes, yes. So normally you breathe normally, not a problem. But when that tongue goes up and back, it's pushing on that epiglottis and your trachea is going to be closed off. You're going to have trouble breathing. So whether you're breathing from your nose or your mouth, the passage is closed off.
Yeah. So students, just so you know, dentistry is more than just the teeth, right?
Yes.
It's much more than just the teeth. It's all the structures that surround the teeth and some of the structures that you can't even see or that you won't see as well.
Yes. And I think a lot of times, a lot of Instagram-y dentists, we focus on the fun stuff, the veneers and the crowns and the before and after. That's the fun stuff, and we do that. But there's a lot more that we manage.
Right.
Okay, so this one was a multi-specialty approach. So when he came into my office, I needed to open it up, meaning when I say open it up, meaning the source of the infection was the inside of the tooth. So this is me, when I drilled inside the tooth, this is blood and pus that came up out of the tooth. All that swelling that's down here, I created an access point for it to get out. So all that's blood and pus. But the tooth, that entrance is small. He needed to see an oral surgeon, okay, immediately. So he needed to, thankfully, I'm in a building where I have an oral surgeon, two oral surgeons downstairs. So as soon as I saw him, I'm telling my receptionist, call Dr. Klein and see if they can get him in now. Like the patient will walk downstairs, he'll be there in 10 minutes. So I needed to open it up so that it can come out through the top, through the tooth, and then the oral surgeon need to go in and do what's called an incision and drainage. The oral surgeon need to go in and make a deep incision right inside in that area, and they need to put a drain. It's like a little plastic, it looks like a straw. Imagine a straw, but made of plastic, maybe 3 inches long, and they need to stick it in there that way, and they suture it in place. It has to stay in there for maybe 2 or 3 days because all that pus and all that infection needs to physically come out. Antibiotics are part of the story, but antibiotics outside of a hospital setting, antibiotics take time to work. They don't work immediately. And all of that infection needs to come out because we don't want the patient to end up in a situation where he feels that he has a problem swallowing and he's ending up in a hospital. So I think this is a great case because this highlights with dentistry the medical aspect of it. It highlights us acknowledging these and knowing how to treat things appropriately and aggressively when needed. Right. No, was there? Oh, okay. So this is one slide that shows maybe more of the funner stuff. You've got a before and an after. This is our colleague, Dr. Abernathy. She's a fantastic family and cosmetic dentist in New York City. So before, this was a 43-year-old female. She's a veterinarian. These pictures were shared with permission. Obviously, they're on Instagram because we have to be mindful of patients' rights, but they're shared with permission. She was 43 years old. She's a veterinarian, so she's smart. She's educated. She got her college and multiple degrees, but she doesn't smile at all. When you see her, she talks like this. She smiles like this. In pictures, you would never ever see her teeth. She went to multiple dentists. They accused her of using drugs. They accused her of being neglectful of her mouth. And she's saying, I'm doing what I think I should be doing. I'm doing my hygiene, I'm doing my brushing, my flossing, but my teeth are chipping off. So she eventually found Dr. Abernathy and was very quickly diagnosed with amelogenesis imperfecta, which is a genetic condition. And in the development of the fetus, you've got different layers, the endoderm, the ectoderm, and the mesoderm. And the ectoderm, which is basically when the layer of the fetus, when you're developing as even an infant fetus, there's a breakdown. So the teeth, when they come out, they are going to be very small, rounded, pitted, meaning it looks like there's little grooves and like not holes, but it looks like someone took a spoon and kind of just broke a little chunk out of the teeth. All her teeth look like that. And they were very stained because when you have little chunks missing from the teeth and they're pitted, grooved, all these different things, when you eat your normal food and then if you drink tea, coffee, soda, it's going to stain. And it's not the kind of stain that comes off with just brushing or just a quick cleaning. It's a deep stain. So with this patient, you can imagine if you had graduation yearbook pictures and your teeth were in this position. It's not a good position to be in for her. So she eventually found Dr. Abernathy. She was diagnosed with amelogenesis imperfecta because of the advanced state, because this was missed for years and years and years. Because of the advanced state, Dr. Abernathy went ahead and did full coverage crowns, which means it was past the bonding phase, past the veneer phase. She needed full coverage crowns on almost all of her teeth. But these are the temps that she has on the right side. And you can see this is life-changing work. This is someone that went from never smiling, you would never see her teeth in photos, and showing off all her teeth. And this is the fun stuff that we do as dentists. So we can do the fun stuff, but we also have to be mindful of the medical stuff. We need to be able to manage and take care of both appropriately.
So also as dentists, as Dr. Small mentioned, there are many medical conditions, many things that people have conditions with their body that can affect their mouths, more specifically their teeth. And as you guys can see in this picture, the before and after, She's smiling, yes, in both pictures, but there's a different type of smile on the right-hand side versus the one on the left. This is the type of work that most of us as dentists are responsible for, meaning life-changing results, transformational changing type of results, to the point where even just your smile and enhancing someone's smile, in addition to getting them out of pain, but most importantly, their smile, how changing their smile can change a person's attitude, right? And how they feel emotionally, right? From going from sad and withdrawn to happy, smiling, and also feeling more confident, right?
Yeah.
We have been working with people who have this type of smile transformation and now feel more confident about talking to people, interviewing for jobs, dating, maybe even that. So keep in mind that this is uh, part of how dentistry is integrated into a person's well-being as well, not just getting them out of pain, not just getting them healthy with any diseases or issues or conditions, but also helping them emotionally, behaviorally as well.
And one reason for me in choosing dentistry, what I like about dentistry is we have a lot more control and a lot more mastery over what we do. And what I mean by that is with medicine, you may have a headache and you may have a cold, or you may have a brain tumor. And there's a whole range in between, or you may be okay with Tylenol, or you may be dead in 2 weeks. So there's so much we know about medicine, but there's a lot we don't know about medicine. One thing I really do like about dentistry is that we have a lot more control and mastery over our field, and it's a lot more controllable. So with this person, this young lady, Dr. Abernathy, and us, we knew there was something going on. We knew it's not a drug use case. When we see the pitting, when we see these tiny little shapes of her teeth, she could easily diagnose this amelogenesis imperfecta, so we know what the problem is, and then we can work on a solution. And we can do that easily. This type of case, I don't know her timeline, but literally you can get this in a week to go from the left side to the right side, or even, one whole long appointment. Once you know what's going on, you have your treatment plan. We have to phase it. We're not just jumping in and slapping on some veneers. We got to make sure she's healthy. If she needs a cleaning, make sure the periodontal health is stable. But within a few appointments, within a week or two, she can go from before to even the temporary. These are just the temporary teeth. These are not the real porcelain veneers or the porcelain crowns yet. So you can have much difference. You have a lot more control of the situation in dentistry versus medicine. So that's something to think about.
How are
So
we on time,
let's,
Doc?
yeah, let's answer some questions. It can be about anything from start to finish related to dentistry, clinical stuff, or maybe our pathway to dentistry, um, what needs to be done to become a dentist. We're here. We want to answer all your questions.
And also we'll give you all some resources afterwards as well,
Yeah, yeah. So
that'll
feel
help
free
you along your
to,
journey.
yeah, unmute yourself and jump in. If you don't want to unmute yourself, you can write it in the chat, but just unmute yourself and we'll answer your questions.
Is there any way to fix like oral problems with remedies such as clove and other like natural items?
So everything depends on what your starting point is. Okay. So a lot of times with dentistry, once you feel something, it's already much more advanced than you think it is. So with the clove oil is like a real old time traditional remedy. Um, and it works. The issue is that the problem is that a lot of times by the time you feel it, you're past the clove oil stage.
Okay. I just
So we
found,
use,
sorry. Oh, you can continue.
I was going to say we use clove oil in something called eugenol, which we use as a medicated filling. But for us, by the time you come in and say, this tooth is hurting, I drank some ice water, you'll notice temperature sensitivity, biting sensitivity. We take an x-ray, we see a big, huge cavity. It's past the point of the clove oil.
Okay. Thank you. I also wanted to mention my mom went to Brooklyn Tech too.
Oh, yeah? Okay, good. Awesome.
Adriana, you have a question?
No, I don't have any questions.
So I have a question for you because you're in this room. So what about dentistry is interesting or intriguing to you to the point where you've wanted to get in this room and explore it as a health profession in a career?
I like the fact of like cleaning teeth and stuff and just like helping people get rid of the pain they might have.
Good. Okay.
Okay. Now, is everyone here undecided as far as dentistry versus nursing versus medicine versus pharmacy? Or where is everyone focused more on medicine?
Wait, hello.
Yep, Derek.
I had a different question, but can you repeat what you just said, please?
Oh, my question was, is everyone here undecided as far as nursing versus pharmacy versus dentistry, medicine? Or is everyone here more focused on medicine, but somewhat a little bit curious about other professions?
I've always like wanted to be like dentistry, like into that, because I don't like dealing with like medicine and all that. You know,
So
Right.
you will have to deal with medicine,
I mean, like not like you know what I mean.
hospitals and
Yeah,
stuff.
yeah.
Okay. So you can, yeah, you can be in private practice in your office and never step foot in a hospital, or you can be a hospital-based dentist. Like Dr. Hayes was based in a hospital for years.
So you just like
But
work at a hospital and like,
Dr.
well,
Hayes was in charge of a residency training program that was based in a hospital. So, as such, the students took call. So, he was in a very urban area in the middle of the Bronx. So, if there's someone that got in a car crash and they busted their jaw, they got punched in the face and they broke their jaw, their teeth got knocked out, those are the calls that those hospital-based dentists got.
that makes sense.
But you had
But
another question?
Oh
but
yeah,
they also, oh, go ahead, Derek. Go ahead with your question.
I was gonna ask like, how does the braces and like Invisalign process work? Because I always wondered like, how does that work?
How does it work?
It's a
Yeah.
2-hour lecture.
Oh,
Yeah. So it's a great question because it's talking a little bit more about a particular discipline within dentistry where there are some dentists that go on to specialize, right? Like Dr. Small is a specialist. She's a dentist that specializes in root canal treatment, meaning any infections that originate around or within the inside of the tooth. Her expertise is handling all of those conditions and situations dealing with the inside of the tooth. For orthodontists, their expertise is just what you mentioned, right? Braces, moving teeth, whether they're using metal braces, tooth colored braces, or Invisalign, which is a piece of plastic, right? It's a medical grade plastic that moves the teeth a couple of millimeters every 2, 3, 4 weeks that they wear the trays. They have to wear those trays in their mouth about 20, 22 hours out of the day.
More
And
like
every two,
23 hours a day. Yeah, they have you
yep,
just take it out to eat.
yep. And then um, they have another set of trays 2 weeks later that they put in. And again, incrementally, a little bit every 2 weeks, the teeth are moving into the new position. Um, so that they're straight and in alignment as well. Same thing happens with braces where you have um, only difference is there's metal on the outside of the teeth. There's a wire. You have to go usually every month or so to get a new adjustment, but also a way or modality to move the teeth incrementally over a period of time. So that's how those things work.
thank you.
Do you know somebody who's an orthodontist?
Not really, but my mom
Okay.
is like a nurse. Like,
Okay.
She's a nurse. Okay.
Mm.
yeah,
Nice. Nice. Rashida, you have a question?
I don't.
Taking it all in.
But answering Chanel's question, I'd say I've always been decided on dentistry for a while now. I don't think I plan on switching up. I am very passionate about it, and I think it's just something I want to do long term.
Okay, so what I would recommend for you guys is at any point in time, maybe your first or second year in college or in a summertime break, even now, like if you have a summer break, I think yesterday was Diwali, a lot of the New York City schools had off. In advance, you can Google dentists or orthodontists, oral surgeons in your area and send them an email and call them. You say, "Hi, my name is so and so. I'm interested in dentistry. I'm a student. I'm a sophomore at whatever high school." You tell them like two sentences about yourself and say, "Would it be possible for me to come to your office for a day to shadow you?" Or even a morning or afternoon, whatever, their schedule allows. That way you can get some firsthand observation because right now you're an outsider looking in. But you may do a shadowing at orthodontist and say, okay, this is boring. I'm not going to do this. Let me look for an oral surgeon, and you may love it or you may hate it. I did a summer program in at Howard Hospital, spring break program, and another girl in a program, she fainted. She passed out the first day in oral surgery. She was like, "This is not for me." So I would recommend that for you guys, even as a high school student. I would say a morning is good. Like, go there at 9, leave after lunchtime, and then they'll even, see if you can spend lunchtime them and just ask lunchtime with them, asking them questions, just picking their brain on things, and just getting more of an inside track.
Now, Rashida, where are you from right now? Where do you live?
I live in Canada, but I'm from Jamaica.
From Jamaica. Okay. So
Yeah.
do you and your family, do you guys have a dentist in Canada that you've been going to?
Yeah. His name's Dr. Posh.
Yeah, so start with your dentist and Google others because everyone may not be open to it. Sometimes they're busy, they don't have time, maybe your schedules don't align. So yeah, I would email 4 or 5 different dentists and call their office to follow up and just see if it's okay, because that would be a really good inside experience for you guys. And then you'll maintain touch. And then later on, when you're filling out applications and you need letters of recommendation, these are people that you're going to ask.
I mean, because last week, Monday, someone recommended to me that I should call different dental clinics in my area and see if I could volunteer, get some volunteer hours, and
That
do
too.
talking about. I'm currently waiting on a response from one of them. So,
Hmm. Well, for you, if you're international, you're not looking to get paid for this.
no,
So, yeah, so the paperwork part may not be as critical as you think it is. So, we've got some summer programs that we want to give you some information on.
Yeah, so I mentioned this, I put this resource here for you all, and I can't remember if this program is eligible for high school students. It may be more for first year college or second. I know it's definitely for first or second year college. However, this is a resource. So Christopher, Adriana, uh, Malian, I keep messing up her name. Madeline, Derek, Rashida, for all of you that are on the call and in this room, this is a resource for you to look into. It may be applicable right now, or it may be applicable in 2 years from now. But add this to your list of things that's helping you gain some more information, whether you're decided or still deciding on dentistry, right? Because you will need to have different types of experiences, like Dr. Chanel mentioned, as it relates to shadowing, um, um, to help you eventually apply to dental school, even to apply to some of these programs. What you experience as part of your exploration into the profession will allow you to have content that you can write on an essay, on a
Mhm.
personal statement, or just when you're talking to other professionals in dentistry about your interest. You want to have some content that you can talk about, some experiences, right? And you don't have to be a dental student to be able to talk about dental experiences, whether it's for you as an individual going to the dentist. There are many dental students, even specialists like orthodontists that have said their passion for dentistry and the reason for them wanting to become a dentist or an orthodontist was because of the treatment that changed their life as a kid, whether it was braces, whether it was um, a tooth infection or a tooth in the front that didn't allow them to smile, right? So you can have those types of experiences as well as the ones that we're talking about, where you are actually learning and interfacing with dentists in your community or other people that may know dentists that would be more than welcome to have you come and learn and shadow in their office. But here's the deal. You've got to initiate that. We're not coming to you to see if you want to do it, because this is part of your exploration, part of your journey, right?
And Dr. Hayes, I know you have one more slide with our contact information. If you can allow me to share my screen, I forgot to add the QR code. I do have a QR code that would have you can get an email with this presentation. That way you'll have those websites, and you will also have Dr. Hayes and myself contact information, Instagram. He shares a lot on Instagram. He has a YouTube video, the podcast, to keep in touch and ask questions. Whatever you need, we're here for you. But let me share. May I share my screen and then they can just take a
Yeah, you
picture of
should
that
be
QR
able
code?
to. Yeah,
Oh,
you should be
okay.
able to. Or and also you guys can
Yes.
send us an email and we can send it to you as well. You should be able to share your screen, Doc. Let me see. While we're waiting, there's some additional resources you see on the screen. One organization that will be very, very helpful for many of you if you have already decided, yes, dentistry is my path. I think that was Rashida and Derek said, yes, this is what I'm going to do. This organization is called the SNDA, stands for Student National Dental Association. It is one of the largest student organizations with members, with dental students that look like most of you, if not all of you that are on
It's
this.
the largest, right?
Yeah,
It's the
yeah,
largest. Yeah.
it's
Hmm.
the largest. Um, and all these people that you see on the screen are dental students. Many of them have graduated since this picture was taken last year. But this is just one one drop of the number of students that are in the over 60 dental schools across the country. All right. The 60 schools that are across the country. They
Hmm.
have they have a kind of like a big brother, big sister program with all, well, with several schools, undergraduate schools, and some high school, pre-health high school associations that are interested, or students are interested in careers in dentistry. It's called the undergraduate SNDA. Click on this link here that says sndaonline.org/USNDA. That U
Yeah.
stands for
Hmm.
undergraduate. And there's a website waiting for you to explore about resources for you at the college level, but also at the pre-college level as you are matriculating and determining what your path of study will be to get into dental school as well.
And they're very active on Instagram also.
Very great. Yep.
So yeah, you can follow them there and you'll get all their details and info.
One last resource I wanted to share with you. This organization is called Diversity in Dentistry. And there's
Yes. Yes.
another one that's called Increasing Diversity in Dentistry. It's called I I don't have those slides up right now, but IDID.org. Um, that organization, in addition to the one that you see on the screen here, diversityindentistry.org, are pipeline programs for
Hmm.
individuals like all of you that are on the call right now.
Hmm.
This is a pipeline program that assists high school students college students in their pursuit of becoming a dentist. So another resource for you to explore, in addition to the ones that we've shared with you, sign up for their program, their mentorship program. It doesn't cost you anything but time, and you will need the time as you are preparing for this journey. So diversityindentistry.org is another resource for all of you to check out, to look at, and explore.
The 105. But yeah, thank you so much for your time, spending your time on a Saturday to talk about dentistry.
Yes, thank you for your time.
You're welcome, brother. Anytime. Reach out. Reach out. Reach out anytime. Send us an email. Go on YouTube. Go on Instagram. Send us DMs, questions, help, requests. If you're trying to network with someone, a dentist in your area where you're living, whether it's Canada, Houston, Jersey, Brooklyn, New York, reach out to us. We probably know somebody that would definitely, well, not probably, we definitely know somebody in your area. We definitely know somebody in your area who can, you can partner up with and possibly shadow, talk with. And they will also refer you and get you connected to other individuals so that you can grow your network of people who are already doing the things that you all want to do in becoming a dentist, who are already going through this process when they were high school students, college students, pre-dental students, and then dental students as well. So make sure you all are leveraging the power of connecting with others throughout this process. I think we got a minute left. Last call for questions. Rashida, you good? Adriana, you good? Madeline, you good? Derek, you good?
Yeah, I'm good.
Yeah. Thank you for your time today.
Thank you.
Awesome.
Everyone have a good weekend. Be well. Be in touch.